I'm a board-certified ophthalmologist specializing in cornea, cataract, and refractive surgery. I chose ophthalmology because I really like the aspect of being able to see patients in clinic and forming long-lasting relationships with them, but then also being able to do procedures both in office as well as in the operating room. I think the best part of my job is the ability to be able to give someone's vision back through either cataract surgery or corneal transplantation. And I find that very rewarding. And that's one of the main reasons why I went into ophthalmology. There's definitely been improvements in ophthalmology. The technology is always being more and more advanced. There's more intraocular implants and new technology that are able to help patients get the best vision possible. Also, new lasers that are coming out in terms of corneal transplantation. There's new techniques. We have a very new technique like DMEC or something called DWO that can also improve patients' vision without even needing a corneal transplant anymore. I went to school at Temple University. I did my undergrad in biology as well as minor in healthcare. I did not know that I wanted to be an ophthalmologist. I did know that I wanted to pursue a career in medicine, but it wasn't until I was in my third year of medical school doing my rotations that I happened to just rotate in 2 weeks in ophthalmology, and that's when I fell in love with ophthalmology. It was also in my third year of medical school when we were doing rotations that I really got a feel of wanting to be in the operating room and really using my hands to do surgical procedures. I did an internship year at Chester Medical School, and then I did 3 years in ophthalmology at SUNY Downstate in New York. I then further went on to do a corneal and refractive fellowship at Medical University of South Carolina in Charleston, South Carolina. It was definitely my fellowship that really honed in my surgical skills and really gave me the ability to be confident in doing both corneal transplants as well as cataract surgery. I had great mentors during my fellowship who really taught me how to diagnose corneal disease and pathology, as well as how to properly manage them, both medically and surgically as well. I definitely emphasize patient education and really making sure that the patient understands their disease and the treatment plan, and working together to really create a treatment plan that works for both of us. I think it's all about making sure that the patient is comfortable and understanding what's going on with their eyes and how we can both work towards making their eyes better.